Hi, my name is Jennifer Cashin, and I'm a Regional Technical Specialist for Alive and Thrive, based in Myanmar. Alive and Thrive is an initiative to save lives, prevent illness, and ensure healthy growth and development through the promotion and support of recommended maternal nutrition, breastfeeding, and complementary feeding practices. Alive and Thrive is managed by FHI 360 and is currently funded by the Bill and Melinda Gates Foundation, IRISH, the Tenoto Foundation, and UNICEF. As you all know, breastfeeding is one of the best investments that can be made to save lives and improve the health and economic development of individuals and nations. But despite all that we know about the benefits of breastfeeding, global breastfeeding rates remain unacceptably low, and the world is not yet a friendly place for breastfeeding. Globally, a mother's return to work is one of the leading reasons for stopping breastfeeding early. It's no surprise then that extending the duration of maternity leave results in improved breastfeeding rates. But did you know that longer maternity leave is also associated with reduced infant mortality and improved health and well-being of mothers? The type of work environment that a mother returns to after her maternity leave also has a big impact on her ability to continue breastfeeding, and so does her partner's workplace environment, because breastfeeding is not a one-woman job. The fact is, no mother or father should have to choose between a paycheck and providing the best nourishment and care for their children. Family-friendly workplaces provide a part of the solution to this issue. What is a family-friendly workplace? It's a workplace that provides paid leave, time, space, and support for breastfeeding and allows for access to affordable childcare nearby the workplace. It could also include other accommodations like remote working, telecommuting, or flexible working hours. The evidence is clear. Family-friendly workplaces and policies are beneficial for families, for employers, and for countries. In summary, paid parental leave and workplace breastfeeding and childcare accommodations have been shown to afford fathers more time with their children, to contribute to increased maternal earnings, and better health outcomes for mothers and children. On a national level, this translates to reduced healthcare expenditures, increased female labor force participation, and this translates into major increases in GDP as well as more gender equitable social norms. And the world's leading employers are also investing in family-friendly working arrangements because they result in cost savings due to increased employee retention, reduced absenteeism, improved productivity and morale, as well as a positive public image. In this slide, I've summarized a few of the key components of a family-friendly workplace, which you can view on your own. Next, I'd like to share a case study on workplace lactation support programs from Southeast Asia. As you can see, Viet Nam has a favorable policy environment for breastfeeding mothers, offering 6 months paid maternity leave and 1 hour of paid breastfeeding breaks daily. Alive and Thrive worked with the Vietnam General Confederation of Labor to develop and scale up a workplace lactation support program to over 70 worksites nationwide that reached over 150,000 female workers. This initiative was made possible through a partnership between Alive and Thrive, the VGCL, and employers, with each partner contributing an important component of the program. And this program followed 5 simple steps to enable adequate conditions for women to continue breastfeeding after work, namely selecting a site where the breastfeeding or lactation space would be located, developing education materials, orienting and training female staff, line managers, and other key personnel, and installing lactation rooms and monitoring and supporting operation of these rooms. Building on the lessons learned in Vietnam, Alive and Thrive, UNICEF, and other partners recently started working with local businesses in Myanmar to expand workplace lactation support programs. Through an advocacy campaign led by the Ministry of Health and Sports, Save the Children, UNICEF, and Alive and Thrive, one of the nation's largest local companies, KBZ Bank, began getting interested in how it could improve the health and well-being of its employees. In just a few short months, KBZ Bank established lactation spaces and childcare accommodations in several work sites and also instituted a new company-wide policy that allows mothers paid breastfeeding breaks each day. Building on this example, Alive and Thrive and UNICEF are currently working to develop a toolkit for employers that includes training modules, communication materials, and support for setting up and maintaining workplace lactation support programs. After a pilot phase and through partnerships with local business associations, we are looking to scale up this initiative to many more workplaces. And we're also working with government to advocate for more family-friendly policies and laws, like extending the duration of paid leave for parents and mandating paid breastfeeding breaks each day. We will keep you in the loop as this work progresses. Thank you very much for listening, and please get in touch with us at Alive and Thrive if you would like any additional information.